The cost is just astronomical. And when you think cost, people think about money, but there are so many different elements. In terms of the way you define addiction as a bio, psychosocial, spiritual phenomenon, I mean, there's costs on all those dimensions. There are costs to us as individuals and our health when we misuse and abuse drugs. There's costs to our family. There's costs to our workplace, our community, our society. You look all the way from the issues in the east side of Vancouver to northern Canada and issues with solvent abuse and alcohol. We look at communities where there's poverty. We have communities where there's affluence and no family support, where young people get into drugs because they're bored or they don't spend time with their parents. So if you look at the entire person, you look at their family, the community, all elements are impacted. Most of us have used drugs at some point in our time. Drink, smoke some cannabis, take some prescription drugs. What occurs is that when we look at this and go, why can I do it and someone else? We start passing a moral judgment. We look at the fact that there's something different between me and the person that is using and can't handle it or can't control it. So we don't look at them as an individual. We look at them as an object. We look at their trauma history, their family history. What makes me better than them? And that foundation called the moral model is very rampant in society. We don't appreciate the fact that people have biological differences. We don't appreciate the fact that people have had traumatic instances, that they've had issues of abuse or trauma that impact them and make them different. So instead of trying to see a person, we make them an object and we blame them for their drug use. I think the most important element is to understand that this is something that you can recover from, that there's an opportunity for help. There are many good agencies available out there to provide it, and to acknowledge the fact that if you have a substance abuse issue, you can recover from it and become healthy again, BU 16 or BU 68. There's always an opportunity to move forward. I've worked in the field for nearly 3 decades. There's some outstanding clinicians, outstanding medical personnel working out there, nurses, doctors, a whole range. However, the way that addiction is funded is very hamstrung. You have funding through Ministry of Corrections, you have funding through health, you have funding through social services, and this limits the type of help that many agencies can provide. So the biggest issue is the fact that our system has been created through silos, and so you don't have many agencies where you have a medical doctor or a social worker or naturopath working together, and this limits the ability to treat the whole person. One of the most important things in the 21st century is no longer to believe, but to know. And so in Habitude, my purpose is to bring knowledge, is to provide the most up-to-date, empirically based assessment information, outcome evaluation. So if you're coming to this agency, we want to know that our service providers, clinicians, and staff are providing you the most appropriate and scientifically tested methodologies. So everything that we're doing here is going to be evaluated, and my job is to make sure that the program not only is good to start with, but evolves and continues to serve clients to their best possibility. Addiction is far more complex than most people realize. It took us centuries to get from the idea that there's something wrong with you, a moral failing, to that you're sick and diseased. But the disease model, which emerged in the 1930s, and you want to think about that just for a moment, is that if you had a heart surgeon, would you want a heart surgeon operating you from 1930s philosophy? I hope not. The disease model is fantastic. It was a huge paradigm shift forward. It appreciated the fact that there's a biological issue. But science has advanced so much since those early days. We understand now that there is brain chemistry issues. We understand the impact of personal interactions and upbringing and family. We understand the impact of a variety of trauma, physical abuse, psychological abuse, neglect, and the impact they have on you. We understand the social context of drug use, the environment you bring in. I mean, the beautiful thing about living in Canada, we're exposed to people from all over the world. But as my father was a refugee, there's people today that are refugees, and their whole social experience creates a different environment from which they view the world, which impact upon them. You need to treat each individual as an individual. You need to look at their biological needs, their psychological needs, the social context that they live in, and address all of them. You need to look at their spiritual needs, look at what they're doing in terms of their education, occupation, and work, and provide a program that addresses all of those. People who have been using drugs in any manner that's impacted upon their lives, it's affected them personally, affected them occupationally, affected their family life, affected the ability to get up and interact with the world. The program offers so many different vantage points, and with the unique assessment that they're using is that the programming will be tailored to individual needs. Typically, however, it's people who because it's a residential program, are able to be away from work or away from home for a period of time and dedicate themselves to becoming well again.
Thank you. You mentioned the Turning Point Detox and Habitude programs is one of the only authentic biopsychosocial programs available in Canada. Why do you feel this is the case?
Again, as I mentioned earlier, is that the current funding structure is built around silos, is that there are specific funders that only look at or only allow the staff to look at one dimension of the individual. And again, there are other institutions that do multiple perspectives. But because this is a private self-funding agency, they're allowed to bring in professionals that meet the needs of each individual client and provide an individualized program that isn't tied by external funders. What we have is a continuum of need. There are people who use recreationally, casually, in an integrated manner, in an abusive manner, in an addicting manner. And what we need as a nation is to have a whole continuum of treatment care so that wherever your drug use is, when it's problematic, you can get help. And there's no doubt an agency like Turning Point offers a new part of the continuum that we've not seen before in Canada and will serve a group of clients that typically have not been served in the past. The most important part of being a counselor is to be a hope bringer, is to be able to find the chance that life can be better. And I think the staff and the people working with Turning Point are all hope bringers. I mean, not false hope that life's going to be better. Just, you know what, have a cup of coffee, everything's great. If you work hard, if you want to change, you have the support around you. We have the capability to make your life better. I've got a wonderful formula that looks at it, and basically that if you have staff, you are losing money because of addiction. The interesting part is that employee assistance programming, occupational social work, in essence, arose out of the AA movement. It arose out of addiction. What we have found is that over the years, because it casts a broader net and looks at a whole range of problems, as it should, is that the addiction component has been lost. There was a study that was published earlier this year in mid-2011 that indicated that upwards of 20% of counselors have no ability to assess and treat addiction properly. That means people who are actually providing help don't understand the complexity and nuances of addiction. The workplace is impacted negatively. We know that there's huge economic chaos in the world right now, and I don't know a workplace that can afford to lose 10 to 15% of its productivity because it turns a blind eye to addiction. As I was just mentioning earlier, is that because we look at the whole range of problems now, and often presenting problems are examined. So an individual comes and says, I have a family issue. And so they deal with a family issue. But because so many EAP programs now are short-term counseling, 4 or 6 sessions, they don't understand that the underlying issue is not the family problem or not the marital relationship. It's driven by an addiction issue, or is it driven by a trauma issue, or is it driven by an eating disorder. So the difficulty in short-term programming is we don't often get to the underlying problem. So while you treat what's come forward, another problem will emerge until you get to the underlying issues. I think this offers a new opportunity, a holistic program that can't be found anywhere else. So it gives you a wonderful opportunity to treat the whole person, which is what addiction is, a whole phenomenon.